Good evening, seventh graders. Tonight, I want to present an online lesson covering alcoholism and treatment for alcoholism. We've been covering alcohol now for a couple of weeks, and I want to begin to close that part of our unit down. We will continue to watch Sarah T. Profile of a Teenage Alcoholic. We'll finish that up because you'll actually be able to see how someone progresses from their first drink into alcoholism and what happens to their lives. So that's an important movie for you to watch. But as far as lessons go, this will probably be the final lesson, and from here we'll move on to other substances that are abused and uh, what the effects are from those particular drugs and substances. So tonight, alcoholism and treatment. Um, if you think about what we've talked about, teenagers drinking, college age students drinking, and you you realize how much binge drinking really affects whether or not they're abusing alcohol or not. Not many kids, teenagers sit down with their friends to have a drink, a beer. When a group of kids get together, college students, high school kids, usually they're drinking to get drunk, and we know that binge drinking is defined as drinking a large quantity of alcohol in a short amount of time. Teenagers uh, who are abusing alcohol show signs and symptoms, and they're some of them are easy to recognize, and some of them are a little bit more difficult. Lying, uh, becoming moody and abusive to others, choosing to isolate maybe, changing friends, not following rules or boundaries that parents set down. Also, they may have some alcohol paraphernalia. And what we mean by paraphernalia are things associated with drinking. So if someone has a beer bong, or they have shot glasses, they they may have different drinking game uh, equipment and materials that they need for drinking games. And then, of course, if they smell of alcohol, that's another sign that they're really doing a lot of abuse with alcohol and using it in a way that is, well, first of all, if you're a teenager and you're under the age of 21, that's illegal for you to be drinking anyway. But you know that if they're smelling of alcohol, they're drinking more than just kids that happen to be at a party and consume alcohol. If they're smelling of alcohol on a daily basis, you know that they really do have a problem with alcohol. Um, Here's the question though. If a teenager is abusing alcohol, is he or she an alcoholic? Good question there. Not necessarily. A teenager or anybody who is abusing alcohol, there's sometimes a big difference, sometimes a small difference between being an alcohol abuser and an alcoholic. And abusing alcohol would mean that you are using alcohol as a crutch. Maybe you're partying too much, you're doing a lot of binge drinking, but as as an abuser of alcohol, if you choose to stop, you're able to stop. If you are an alcoholic, now a lot of the symptoms of abusing alcohol become much worse, and you are really not able to stop on your own. You cannot stop using alcohol without help. Usually that means you're an alcoholic. Let's look at some of the signs and symptoms of being an alcoholic. First of all, And as we talked about when we discussed binge drinking, we talked about blackouts, where there are periods of time when you're drinking that you don't remember. Well, if you're an alcoholic, those blackouts become more frequent and they last longer. So the memory loss and blackouts are more significant than someone who's just abusing alcohol. Um, and uh, their reliance on alcohol becomes much more serious. So if you see them and they are needing to drink even during the day to cheer up or improve their mood, that's a significant symptom. Another big one is trying to quit drinking but always fails. Okay? Having to drink to feel okay about being with other people. Because if they're not drinking, they feel anxiety. They feel uncomfortable being with other people. Um, Sometimes if an alcoholic has been an alcoholic for a very long time and they're really consuming big, large quantities of alcohol, their face will get flushed and little vessels called capillaries will start to break in their face, and you can see the little capillaries around their nose and their cheeks, and that's a symptom that now the alcohol is affecting them physically. Um, Eventually, when someone is an alcoholic, they can't control trembling in their hands, they feel shaky, and the only way to control that is to have another drink. Um, and socially, there's problems with family and friends, and before you know it, they start drinking in secret. They may lie about the amount that they are consuming. Um, and as you remember in the movie Sarah T, you started to see her hiding alcohol around the house. Adults who are alcoholic or college students who have a job may hide it at work. People may put vodka or a clear type alcohol in a bottle of water so they think that they can get over on other people. The problem is that others can smell it on them. Um, and, without alcohol in their bloodstream, like I said, there's anxiousness, there's difficulty sleeping, there may be nausea. Um, and alcoholics tend to need to drink in the morning. They need to start their day off with some alcohol and basically needing alcohol to function in life. So, what happens when an alcoholic wants to quit? Well, the first thing that happens is if they try to quit drinking, they start to experience withdrawal symptoms. And this can be an extremely dangerous situation, depending on how much alcohol their body is used to having inside of it. So if somebody doesn't drink as much, but they're very reliant on it, they're still an alcoholic, but the withdrawal symptoms may not be as bad. The more a person drinks on a daily basis, the worse that the withdrawal symptoms can be. Okay, and it can start uh, within hours of having a drink, and it can uh, it can last, a couple of weeks actually. And so when people stop drinking, um, it can go from mild anxiety and shakiness to actually having seizures and the DTs. So when someone goes into treatment, there are three things that the treatment center tries to help them with. The first is, of course, reducing the withdrawal symptoms and preventing complications from the withdrawal. So they go to a place called detox or detoxification center, and that's where their body withdraws from the alcohol. and often they're given medication to try to help the person with the symptoms and to keep them safe because their body is actually starving for alcohol, and serious um, situations can happen with a person's health. After the person has detoxed and all the alcohol is out of their body and their body is okay, they move into rehab. And rehab consists of group and individual therapy, support groups. They'll go out to town or outside the rehab center to go to AA meetings. And they begin to learn to live without using alcohol, which is a huge deal for an alcoholic because they've come so accustomed to using alcohol and to needing alcohol to function. They need to learn to live in a sober way. And family members, usually toward the end of rehab, will join the process to help and support the person. Finally, after leaving rehab, a person continues by attending AA meetings, and they work something called the 12 steps, which is the process of staying sober and following a system by which to live. And last but not least, a recovering alcoholic is the name or the title that an alcoholic who is sober gives themselves, because alcoholics are never cured. They are simply in remission. And as long as they go to AA meetings and they don't pick up a drink, they can remain sober and they can live a good life. But if they do pick up a drink and they start to drink, usually alcoholism starts all over again. And in fact, it becomes worse and they need more alcohol. And this is called relapsing, when a sober alcoholic or a recovering alcoholic uses alcohol, they relapsed. And so they have to start the process all over again. And so basically, that is what addiction or alcoholism looks like and what people do in treatment to learn to get sober. So, what are we going to do for our assignment? What I would like you to do is, I would like if you have 2 bullets, and those 2 bullets, I would like you to talk about any experiences you've had in your life with someone who is an alcoholic. So 2 bullets on what you experienced, knowing someone who was an alcoholic. And if you don't know anyone who was an alcoholic, what I'd like you to do is write 2 bullets about what you think it might be like to go through treatment in a rehab. What would be the most difficult for you, do you think? Would it be learning how to live sober? Would it be going to meetings? Would it mean dealing with your family? Um, the detox process? What would be the most difficult for you? So either a bullet, and please don't name names if you talk about your experience with someone who was an alcoholic. Um, please do not put any names in there. And if you're choosing the other, where you're writing about what you think you would find as the most difficult in the process of treatment, um, then you don't have to worry about names. Okay, and I will see you soon. Thanks.